Assalamualaikum. My name is SITI HAQIBAH from SR135A. May I know what is your name?
My name is Haziqah AMIN.
Okay. So now I will interview you for the evaluation process for subjective evaluation. So may I know what sport do you play?
I play hockey at UiTM Police.
Alright. So may I know what is your injury?
I got an injury at ankle.
Alright, ankle. So how do you get the injury?
I got an injury during that tournament, which is that when I dribbled the balls to the goal, and the goalkeeper was run to me to tackle the balls, and suddenly I was turned my body, and unfortunately the goalkeeper does not tackle the balls and he slapped me. And after that I was feels throbbing, and after 2 hours and I feel that my ankle was swelling.
Swelling. So your ankle was swelling, alright. Can you show me where or which part that you feel the pain?
This area.
Alright, the area, okay. From 0 to 10, how much you rate your pain?
5.
5, alright, 5. And then during the injury, do you notice that is there any sound like popping or clicking sound?
Clicking.
Or you feel that clicking sound? So the next question is, after you feel the pain or after you get the injury, did you do anything to reduce the pain or the swelling?
Yes, I do. I'm just simply put ice on my ankle.
Alright, put ice on your ankle. So for now, do you still feel the pain now?
Yes.
Did it getting worse or getting better?
Getting worse.
Getting worse. Alright. So the next question is, do you feel any symptom like tingling or sharp pain that happen during the random time?
Yes, I still feel that.
Yes, you feel that. And the next is, during you rest, do you feel any pain at the injured part?
No.
Next, how about when you do a daily activities, do you feel the pain or not?
Yes.
So my last question is, during or when you sleep, do you still feel the pain that makes you awake at the night?
Yes, I still feel the pain.
Right, so you can feel the pain. So that's all for the subjective evaluation. Before you continue for the next process with my teammates, I would like to see your postural alignment. So I would like to see you stand up and face the camera and follow my instructions. So let's start.
Okay.
First thing, you need to remove your sandals and your cap. Okay. For the first one, I would like to see your anterior view. So your head is normal, but your shoulders like left side internal rotation. Okay. Then your hip is normal, your knee is normal, and your ankle in the anterior view is normal. So the next one, I would like to see your posterior view. So your posterior view, your head is normal, your shoulder is also left side internal rotation, your hip is normal, your knee is normal, and your ankle is normal. So for the next one, lateral view. So I think it's same. Your head is normal, your shoulder is normal. Your shoulder is I think also left side internal rotation. Your hip is normal and your knee is normal, but your ankle is slightly high arch on the right foot. So the next one is medial view. So medial view, from I think head shoulder is normal as like anterior and posterior, but for the medial view for your ankle, it's also seem like high arch. So I think that's all for the postural alignment.
Hi, Mr. Hakan.
Hi.
Based on the information that I get from the interview just now, I will do some tests for you.
Okay.
Next, we move to the part observation and inspection. That's the first term is the active range of motion. We known as the arrow. You know what is the arrow?
No.
Arrow is the athlete actively contract to muscle by yourself. And then the function of the arrow is to more know details about where is your pain, especially at your ankle, right?
Yes.
Okay. For not wasting time, sit there and then follow my instruction. Can?
Can.
Careful, ah. Okay, sit there. Can you remove your shoes?
Can.
For the AROM, that's we call arrow, we have two parts. This is extension and flexion. Okay, for the extension is the when you ankle forward as far as you can, and then for your flexion is when you pull backwards your ankle as far as you can. Okay? You know?
No.
Okay. The ratio of the flexion and extension just take turn only. Okay? We start with your left ankle. Can you do the extension for me? Okay, on my count. Stand by. Stand by. Go. 1, 2, 3, 4, 5, 6, 7, 8.
1, 2, 3, 4, 5, 6, 7.
Okay, good. Okay, now do the flexion for me. On my count. Stand by. Go. 1, 2, 3, 4, 5, 6, 7, 8.
Flexion. Stand by. Go. 1, 2, 3, 4, 5, 6, 7, 8.
Okay, for the left ankle that we can see, you move so perfectly and don't have any reaction as you have a pain, right? You don't have a pain, right?
I don't have pain.
Okay, now we move to the right ankle. Okay, now you do the extension to me. On my count, 1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8. Do the flexion for me. On my count, stand by. 1, 2, go. 1, 2, 3, 4, 5, 6, 7, 8. Next, for the right ankle, as I can see, you feel a pain right for your flexion and extension.
Yes.
Okay, so we can see the right ankle, you don't do more movement when we compare with the left ankle. Observation that we can conclude is you just move by your personality abilities. So it's suitable because you still have a pain and then you still in the recovery phase. Okay, Mr. Hakan, now I will pass to the next process to my teammates 1.
Alright, now we will proceed with the PROM test. PROM test is the passive range of motion. It is the same as arrow, but this time I will extend your ankle until you feel pain. First of all, I will explain to you what is the PROM. PROM is the maximum range of motion. It is usually performed when you are unable to move your injured part. The objective of this test is to know the level of pain of your injured part until I extend your ankle. Okay, now I will start the test for the flexion and extension with your left ankle first. Okay, we will start with the flexion first. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8. Okay, then we'll proceed with the extension. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8. Alright, next we'll proceed with your right ankle, which is your injured part. Now I will start with the flexion. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8. Alright. Okay, next we proceed with the extension test. I will start. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8. Alright, that's it for the test. From the test, we can conclude that your left ankle can extend more than your right ankle because of the injured part, and I'm sure you feel the pain with your right ankle. So that is all from me. Thank you. Okay, next we will proceed with the next test. First, you can have a seat here first. Right, you can wait here for a couple of minutes until our next my teammate PUTRA will conduct you with the resistance strength test. Right.
Alright, so without wasting our time more, can we begin?
Yes.
So first I would like you to lay down in a supine position so that I can inspect your injury more clearly, right? So you can get up, okay, and then I want you to lay down. Okay, lay down right here. Alright. Alright. Okay, then I want you to put your leg on the knees at a 90-degree angle, alright, with your ankle pointing upward. Alright, so I will fixate my hand right here.
Yes.
And so I will put my foot right here, and so I will put some pressure in here, and then I want you to resist my pressure when I put my down here. Think of it like bringing your toes to your head. Is it clear?
Yes.
Right, so we can start in 3, 2, 1, go. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alright. And so I will begin on the opposite side. The same thing. Alright. I want you to resist my pressure when I put here. Alright. Ready? 3, 2, 1, go. 1, 2, 3, 4, 5, 6, 7, and 8.
2, 3, 4, 5, 6, 7, 8, 9.
Right? Okay. And then I want you to put your leg straight down. Alright. So from here, I will hold your leg like there. Then I want you to do the same thing, which is think about bringing your toes to your head so that I want you to resist the pressure that I put here. Alright, ready? 1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Right? So the opposite side. Ready? In 3, 2, 1, go. 1, 2, 3, 4, 5, 6, 7, 8. So that is the right ankle. And then we will move on onto the left ankle. So right here, we do the same procedure again with the left ankle. Alright, so we see how much strength in your left ankle. Alright, ready?
Yes.
3. I want you to resist my pressure. Ready? 3, 2, 1, go. 1, 2, 3, 4, 5, 6, 7, 8. Alright, so the opposite side. Ready? Resist my pressure. Ready? 1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8. Straight out your leg. We do the same thing again. Ready? Resist my pressure. Ready? 3, 2, 1, go. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. Alright, and then the opposite side, do the same thing again. Ready? 1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8.
2, 3, 4, babi 5, 6, 7, 8, 9, 10.
Alright? Okay. So from here, I can conclude that both of your left ankle and right ankle have the opposite grade of muscle strength. Okay, so what is muscle strength? Which is divided into five grade. Grade 0 until 5, which is grade 0, meaning that you does not have any strength to resist my pressure that I put on your ankle. So I can see here that your your right ankle, when I put some pressure in here, you can resist, but it is I can see fairly strength, right? But when it comes to the left ankle, it is completely normal and good, which is I can see that you can hold up a lot of pressure that I give on the left ankle. So I can conclude here that both of your ankle, especially on your right ankle, is in a not so serious injury, which is I can see that you can give. I can clarify it. It is at grade 3, right? So to conclude this, I'm going to pass you to my teammates, which is Najlaa, which is she will explain more further on what treatment that you should perform to improve your recovery journey, right? So do you have any questions that you want to ask me?
So I think what good treatment can I do at home to reduce my pains?
Unfortunately, I cannot give you the answer because I am not a specialist in the treatment parts.
Okay.
I am more specialist in the testing part, which is I can give you the diagnostics on the treatment results. So I believe my teammate Najlaa will explain further on what you should do to improve and speed up your recovery process.
Okay.
Right? So I will bring you to her. Right? And sit down. Okay. Thank you, Ms. Haziqah, for your cooperation. I hope I do not see you again here, as I know that you are in pain and improve your recovery journey.
I'm too.
Okay. So you can
Thanks
sit
a lot,
down.
Mr. Putra.
Alright, you're welcome. Okay. I hope I do not see you again here. Okay, thank you.
Okay, my name is Najlaa. So I will suggest you a treatment for your injury. First of all, I want to ask you how you feel after the all session.
Actually, I feel great during that 3 months because that's as well as I can know that serious injury in my ankles during that 3 months.
I see. I heard you use ice for your treatment. So how do you do?
I just simply put on ice in my ankles every night before I sleep.
I think that's the wrong way to do. So now, I'm gonna share to you to use rice treatment. So do you know what is rice treatment?
No.
Okay, let me explain. Okay. So first, R. R is for rest. So I think you need to avoid activities that causes pain and swelling. So I think you need to stop playing hockey for a while and until the swelling not feel anymore. Okay, then second, I for ice. So you need to use an ice pack immediately for 50 to 20 minutes and repeat every 2 to 3 hours. Then third, C is for compression. So, to help stop swelling, compress the ankle with an elastic bandage until the swelling stops. Okay, and lastly, E is for elevation. So, to reduce swelling, elevate your ankle above the level of your heart. So, as example, you can use pillow. Okay, then, so if breast treatment not effective to you, I'm gonna suggest 4 treatment that you can do. Okay, first, you can do X-ray. This is because it can produce image of the bones of the ankle. Then second, MRI. So, it can produce 3D image of soft internal structure of the ankle. Then third, CT scan. It can reveal more detail about the bones of the joint. Then lastly is ultrasound. So, it can produce real-time image. And this thing I think can help you and help your doctor to judge the condition of ligament or tendon when the foot is in different position. So I think that's all for me.
Okay, thank you.
So throughout the evaluation process, we suspect that your leg, especially your right ankle, might have a problem with, which is called ankle sprain, right? So ankle sprain is which is you have a problem in your ligament. Your ankle ligament could be anything from a swell or to core of the ligament. So we would like to suggest you to get a further examination from a certified doctors so that you can confirm on what is the problems that especially regarding with your ankle, right? And we would also like to give our big thanks for you for your cooperation throughout the process. And after we finish our studies, after our research, we will give you the exact copy so that the result can help you to improve your recovery journey as well as getting you back into sports, which is hockey, right?
Yeah.
Which is hockey, getting you into faster, right? So that's all from us. I'm wishing you the best, right? Once again, I thank you for your time. We spent with us, and I wish you the best in your recovery journey, right?
Okay, thanks
Right.
a lot.
Thank you.
Okay, thank you.
Thank you, Mr. Haziq.
Okay, thank you.
Thank you. Right. Assalamualaikum.
Salam.